Billions of dollars. Stolen. Right from the U.S. healthcare system. Most of us never notice, yet we all pay the price. Every insurance premium you pay, every copay at the doctor, every hospital visit. Hidden in the system, someone is exploiting it. In 2025, the U.S. Department of Health and Human Services uncovered the largest healthcare fraud in American history, involving over $14.6 billion. Hundreds of people were charged, yet the ripple effects extend to every American who relies on healthcare. This isn't just a story about greedy criminals. It's a story about systemic failure, patient vulnerability, and the hidden costs of fraud that affect your life. Today, we uncover how this massive scam worked, why it went unnoticed for so long, and how it impacts everyday Americans. To grasp the magnitude, consider this. $14.6 billion could pay the salaries of over 200 SOAR nurses for a year. It could provide health insurance for nearly 7 million Americans for a year. And yet, this money vanished through schemes, false claims, and manipulated billing codes. The takedown involved 324 defendants across multiple states. They were doctors, hospital administrators, clinic owners, and others complicit in the schemes. Investigators revealed networks of clinics and hospitals, falsifying patient records, billing for unnecessary procedures, and in some cases, billing for services never performed. For most Americans, healthcare fraud is invisible. You see a bill, you pay it, you move on. But when fraud inflates costs system-wide, the effect trickles down. Higher premiums, larger deductibles, and skyrocketing out-of-pocket expenses. Healthcare fraud isn't simply stealing money, it's sophisticated manipulation of the system. Fraudsters exploit coding, billing, and insurance rules. Phantom billing, charging for services never performed. A patient may come in for a basic checkup, yet the hospital bills? The insurance company for an array of tests and procedures that never occurred. Upcoding, inflating the severity of a patient's diagnosis to justify higher reimbursement. A mild infection might be coded as a life-threatening condition. Unnecessary procedures, performing surgeries, tests, or treatments patients don't need to maximize billing. Sometimes, patients don't realize they weren't medically required until much later, if ever. Kickbacks and referral schemes. Doctors or administrators receive money or incentives for referring patients to specific clinics or labs, often without the patient's knowledge. Medicare and Medicaid exploitation. Fraudulent. Claims are often funneled through government programs. Because oversight is complex and decentralized, detecting irregularities can take years. Every scheme in the 2025 takedown fell into one of these categories or a combination. Are you aware of any of these schemes? Let me know in the comment section. Click the subscribe button if you haven't. Fraud isn't just numbers. It has real consequences for patients. Take, for example, the story of Lisa, a middle-aged mother visiting her local clinic for a routine checkup. She expected a simple blood test and a conversation about her cholesterol. Instead, her bill showed a series of expensive tests, including MRI scans and specialty procedures she never received. Her insurance covered some costs, but her copay alone exceeded $200. Lisa's story mirrors thousands of Americans who unknowingly become victims of fraud. Even if the patient is not directly harmed medically, the financial and psychological toll is real. Medical debt, stress, and anxiety. These are hidden costs of healthcare fraud. In extreme cases, fraud leads to direct physical harm. Unnecessary procedures carry risks of infection, complications, or long-term health issues. Patients trust healthcare providers to act in their best interest. When trust is violated for profit, the consequences can be deadly. The Department of Health and Human Services, Office of Inspector General OIG, spearheaded the 2025 investigation. It was the largest coordinated healthcare fraud investigation in U.S. history. Over hundreds of agents and auditors combed through records, interviewed whistleblowers, and traced millions of dollars in payments. The takedown exposed criminal networks operating across multiple states, often involving collusion between providers and administrators. Many of the accused were repeat offenders, leveraging loopholes and exploiting weak oversight in certain regions. Some cases were particularly shocking. Clinics billed Medicaid for services provided to patients who had never visited the clinic. In other instances, hospitals performed procedures on patients with no medical justification, fully aware that insurance would cover it. Pause for a second. Have you ever found a suspicious charge on your bill or insurance statement? Drop a yes in the comments if it's happened to you, or no if you've been lucky so far. How could 14.6 billion go missing? Fraud thrives where checks and balances fail. Some of the systemic issues include 1. Complex billing systems. With thousands of billing codes, it's easy for dishonest actors to miscode procedures intentionally. Example, a patient goes in for a routine knee MRI, but the hospital codes it as a complex spinal MRI that costs triple the amount. Since the patient's insurance covers it, they may never notice, but the system just paid out thousands unnecessarily. 2. Understaffed. Oversight agencies. Meant to review and audit claims often lack personnel and resources. Example, Medicare fraud cases in states like Florida pile up for months because the small audit team can't keep up. By the time they review a suspicious claim, the fraudulent provider has already shut down and reopened under a new name. 3. High volume of transactions. Millions of claims are processed daily, making thorough inspection nearly impossible. Example, a large hospital network in Texas submits 50,000 claims a week. Even if an AI system flags suspicious charges, there are simply too many for human reviewers to manually verify in time, allowing bad actors to slip in inflated charges. 4. Fragmented healthcare system. Private insurers, government programs, and hospitals operate in silos, allowing fraud to go undetected. Example, a clinic bills the same patient visit twice, once to Medicaid and once to a private insurer, because the two systems don't communicate. The duplicate payment isn't caught for years, if ever. 5. Limited transparency. Patients rarely see the detailed coding or reasoning behind charges, making oversight almost impossible at the individual level. Example, an ER visit for a sprained ankle comes with a $12,000 bill, listing vague miscellaneous supplies and level 5 trauma charges. The patient, overwhelmed by insurance paperwork, just pays their deductible without questioning the codes. These weaknesses allowed fraud to remain hidden for years, benefiting perpetrators while costing patients indirectly. Share this video with a friend or family member because if a 14 billion scam can happen once, it can happen again. You might just save someone's life or their savings. Subscribe to the White Coat Secrets channel. Every fraudulent claim has a ripple effect. Here's how. 1. Insurance premiums. Insurers adjust premiums to cover losses, meaning the average family pays more each year. Example, imagine a family in Ohio already paying $2,800 a month for health coverage. When large-scale fraud cases hit the system, like hospitals billing for ghost patients, insurance, companies spread that loss across all customers. The Johnsons now see their premiums jump by another $150 a month, with no added benefits. 2's deductibles and co-pays, out-of-pocket costs rise, because fraud inflates the cost of services. Example, a Texas teacher needs an MRI for a knee injury. Her plan's deductible is $2,000, but because fraudulent billing has pushed up market rates for imaging, the MRI now costs $3,200 instead of $2,500 just a few years ago, meaning she foots the entire bill. 3. Delayed access to care. Resources are diverted to unnecessary procedures, potentially delaying care for those who truly need it. Example, in Florida, an elderly veteran waits weeks for a heart procedure because operating rooms are booked for urgent cases. Later, it's revealed those cases were unnecessary surgeries performed on healthy patients to bill insurance, leaving those in real need stuck on wait lists. 4. Trust erosion. Patients become skeptical of providers, reluctant to follow medical advice or hesitant to seek care. Example, after a Michigan father learns his late mother was misdiagnosed for profit, he refuses to take his kids for recommended specialist visits. Even when his son shows symptoms of asthma, he delays care, fearing it's just another money grab until the boy ends up in the ER. Fraud reveals broader systemic issues: a fragmented system, inadequate oversight, and misaligned incentives. Addressing these challenges requires more than arrests. It requires reform, transparency, and patient empowerment. Fraud doesn't happen somewhere else. It impacts everyone who uses healthcare, pays insurance, or relies on a hospital system. $14 billion stolen. Hundreds of criminals charged. Millions of Americans indirectly affected. Healthcare fraud is more than a financial crime. It's a breach of trust, a threat to public health, and a reminder that vigilance is essential. Patients deserve transparency, accountability, and care free from exploitation. By understanding how these schemes work and recognizing the warning signs, Americans can protect themselves, demand accountability, and participate in reshaping a system that prioritizes people over profit. Hospitals should heal, not steal.